Today we'll be looking at a few questions concerning microbiology. So here we have our first question. A 7-year-old boy comes into your office with his mother, who complains that all morning her boy has been urinating red blood, and this has never happened before. The boy claims it does not burn or sting when he pees. There are no other abnormal findings on physical exam. You suspect an infection. What is the most probable agent? Is it A, adenovirus, B, rotavirus, C, strep pyogenes, or D, parvovirus? Now I'll give you a minute to think on that. The answer is A, adenovirus. The patient is presenting with acute hemorrhagic cystitis, which is caused by group B adenovirus. It commonly presents in boys from the ages of 5 through 15 and can present as blood-tinged urine and little or no dysuria. You must be able to differentiate this presentation from post-streptococcal glomerulonephritis, which presents with a more smoky urine as opposed to this vignette, which had blood-tinged urine. Hematuria from adenovirus is not as severe as post-streptococcal glomerulonephritis, where the child appears very ill, swollen in the face, might have hypertension as well as pulmonary edema. The other answer choices do not present with blood in the urine. Now for our next question, we have a 12-year-old Taiwanese immigrant boy who comes to your office with bilateral swollen parotid glands, difficulty swallowing, and headache. He is presenting with a fever, QIZZ, and mom says that he has been down the last few days. If the child's symptoms are left untreated, what is the most serious complication that is associated with this viral infection? Is it A, glomerulonephritis, B, cholecystitis, C, orchitis, or D, pancreatitis? The answer is C, orchitis. The child presents with mumps. The most severe complication associated with mumps is orchitis, which can lead to male sterility. Although mumps vaccine, the MMR vaccine, is a routine procedure, the question stem states that the boy is an immigrant, and you can suspect that he may not have received all of his immunizations. Glomerulonephritis, option A, is associated with strep pyogenes. Cholecystitis, option B, is associated with bile and gallbladder infections. And pancreatitis, option D, is also a complication of mumps virus, but is not as severe as orchitis and leading to the male sterility. And this has been our question series.